Hey guys, welcome to our Mother Care YouTube channel. My name is King Tunde, and today I'll be presenting on the fourth topic in our Maternal Mental Health Care series, which is Postpartum Psychosis. Now, if you've been following our videos so far, I'm sure you already understand what postpartum means. Now, what is psychosis? Psychosis is a mental state in which a person cannot differentiate between what is real and what is not real. Now, what causes postpartum psychosis? First of all, the first cause of postpartum psychosis is genetics. It tends to occur more often in families who already have a history of mental illnesses. So, once there's a family history of postpartum psychosis, the mother has a higher chance to develop postpartum psychosis after delivery. A second cause of postpartum psychosis is for the mother to already have been diagnosed with a mental disorder, for example, schizophrenia. So, another example of a mental disorder a mother could already have been diagnosed with is autism. You have a large baby of mental disorders. So, a diagnosis of any of these causes a higher chance of the mother developing postpartum psychosis after delivery. Thirdly, it's a minor cause, but then it still occurs frequently, sleep deprivation. So this is one of the reasons why sleep is very, very important during pregnancy for mothers, because a case of sleep deprivation can cause postpartum psychosis, especially when it occurs for weeks or months on end to the mother. So we are asked to encourage mothers to sleep more during pregnancy to avoid occurrence of postpartum psychosis. And finally, the final possible cause of postpartum psychosis is rapid hormonal changes that occur around there. Now, we all know pregnancy is not easy. It places a lot of strain on the mother's body. You have hormonal changes occurring here and there. So the series of changes between pregnancy and childbirth, the same series of hormonal changes that occurs between pregnancy and childbirth, could cause postpartum psychosis. But then we don't have any definite proof that this will cause. It's basically just a possible cause. Now we've understood the causes of postpartum psychosis. What are the symptoms of postpartum psychosis? Now, the symptoms of postpartum psychosis are very important to note because these are what allow us to identify postpartum psychosis and differentiate it from other maternal mental health care issues. The first and probably the most important symptom of postpartum psychosis is hallucination. Now, mothers who suffer from postpartum psychosis tend to hallucinate, and then these hallucinations, bear in mind, are usually about stuff that are not real in life, but then to the mother at that moment seem very, very plausible and very, very real. And the hallucinations could range from suspecting a family member of planning evil against them, or suspecting their newborn child of doing something offensive to them at that moment. Now, yes, this sounds very, 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 very implausible because, come on, it's a baby. How can a baby do anything to you? But then it's a hallucination. The mother cannot differentiate what is real and from what is not. So it's very, very important to note that when a mother who has just newly given birth has hallucination, it could be a possible case of postpartum psychosis. Another symptom of postpartum psychosis is delusions, which are thoughts and beliefs that usually are not true. Again, delusions and hallucinations go hand in hand, and we should take note of them when we suspect a mother of having these. A third symptom is a manic mood. Now, what is a manic mood? Usually, mothers who suffer from baby blues have this period of light depression. So, and what differentiates postpartum psychosis from that kind of depression is the mothers have depression in two stages. First of all, you have the manic mood, which is a period of anxiety, overexcitement. The mother is busy doing everything, trying to do everything she can in the house, chores and everything. And then all that period, which is very, very brief by the way, is immediately followed by a period of a low mood, a period of anxiety, stress. The mother has problems sleeping, sleep deprivation, and all of that. So again, sleep is very, very, very important in preventing postpartum psychosis. We are asked to advise new mothers and mothers who are giving birth and women in pregnancy to sleep. Sleep really helps the body to rest and reset after a long period of activity. Now, further symptoms include these. I've stated the major symptoms. Now, the few minor symptoms include a loss of inhibitions. Mothers tend to lose their inhibitions and perform acts that are seemingly slightly immoral. And you have restlessness, the anxiety I previously mentioned in the manic mood. You have periods of confusion, where the mother, like, the confusion is a side effect of the hallucinations, because she's trying to identify what is real and what is not real. So you have that whole confusion occurring right there. And finally, the final symptom of postpartum psychosis is having the mother behave in a very, very different way that is out of her usual character. Now, try and note this, because this is probably the most likely tell for postpartum psychosis. You have the delusions, you have the hallucinations, but then those occur to the mother. So unless she tells you she's having hallucinations, you might not note it. But then when she's behaving out of character, it's a possible tell, and it's basically a warning to speak to her, find out what is going on, because a lot of times mothers with postpartum psychosis do not talk about their symptoms. So once you note them behaving out of character, being restless, speak to them, try and get them to open up to you. And then once you find out their hallucinations and delusions, it's time to take them to mental health practitioner to help them, because postpartum psychosis is very, very, very serious. Now, I forgot to mention originally that postpartum psychosis tends to last for a period of tends to occur about 2 weeks after birth and could last from up to 6 weeks to 2 months. So it's a rather long period as compared to baby blues, which usually lasts for about 2 weeks. Now, how do you treat postpartum psychosis? Now, like I previously mentioned, postpartum psychosis is a mental health issue, and the mother should be taken for care immediately. Immediately it's noted. Now, one of the treatments for postpartum psychosis is to give the mother usually sleep drugs to help with the sleep deprivation, and also antipsychotics to help with the hallucinations and the other symptoms, and also antidepressants to help prevent depression. Now, treatment and care for postpartum psychosis requires the mother to have constant care, both from either from a family member or relative, and from a mental health, from the mental health practitioner. Now, how do you provide support for a mother who is suffering from postpartum psychosis? So you might not be a mother yourself, you might not be suffering from postpartum psychosis, but you probably know someone who is, or have a spouse who is showing these symptoms. So how do you help? Now, after taking them for treatment and having them take medications, one of the best ways to provide support is helping out around the house, because mothers in this period require a lot of rest, they require a lot of a quiet environment. So helping them out with their chores is really important. It helps to take off a load of stress off of their minds, giving them time to deal with their symptoms and come to terms with themselves and their pregnancies. Another way to help them is to take time out of your schedule to listen. You might be a husband, you might be a mother, you have work, you're going out, you're coming out, you have a very, very busy day, a very, very busy schedule. But then take time to talk to them, to listen to them. The mental practitioner the mental health practitioner actually can only go so far to help. But you can also help by taking time to listen to them, talk to them, communicate, give them an opportunity to open up about their struggles, to open up about their problems, and it will actually help resolve the psychosis faster. Furthermore, another way is to limit the amount of visitors you have in the house. Like I already mentioned, the mothers need a period of peace and quiet around the house. So limiting the amount of visitors you have is a good way to provide that, because it gives them that space to think, relax, and sleep without any outside disturbances. And finally, is the final way you can help someone with postpartum psychosis is to take them out, because mothers usually are cooped up around the house. They've got the baby to watch over, they've got so much going on in the house. So another way to help is to take them out, not for a run. You don't have to necessarily take them for a run or to a park or to watch a movie or to visit people. Just take them out for a walk. Let them go out, see the sky, hear the animals, just feel the community around them. Not for long, because it will stress them out, but then keep it short, keep it brief. A 10 minutes walk, a 15 minutes walk, that's fine. To help them come to terms with themselves, accept themselves, accept the community around them, and help them with that process. So now we've come to the end of our video. I hope you really enjoyed that. If you did, please drop a like and subscribe to our channels, because we're coming up with more content over the coming months. Thank you very, very much, and have a nice day.